In medicine today, a patient who is in the hospital for a relatively short period of time, with our average length of stay being somewhere around 4.5 days, could experience up to a dozen handoffs during that time. Handoff being the handoff of care from one physician to the physician taking subsequently, or the provider subsequently taking care of that patient. It could involve coverage at night, it could involve consultation, it could involve handoff from an emergency room provider to an inpatient physician, or from an inpatient physician to a nursing home physician. The patients are also very complex, so therefore there's really a chance for us not to have accuracy. If you remember the old game when we were kids, where we would stand around in a circle and you'd whisper something to the person next to you, and they would whisper to the person next to you until you got all the way around the circle. Oftentimes it wouldn't sound the same at the end, and that's the problem with handoffs. It's become complex because our patients are complex, and it's become complex because we don't have the physician taking care of us from cradle to grave that we used to. We have people who are outpatient specialists, people who are inpatient specialists. We have specialists within specialties. We have specialists that take care of specialists. It's an exceedingly complex system, and therefore the kind of issues that arise during handoffs are equally complex. You have to be able to transmit to a person who may not even be in the same area that you're in the information about that patient which is needed for them to take care of that patient. So it's also made more complex by the electronic medical record, because every patient has so much information that needs to be passed on, that without some kind of process that is consistent, we're not going to be able to adequately take care of our patients in the way we want to take care of them.